Hi, I'm Dr. Frederick Echols, Acting Director of Health for the City of St. Louis. With recent reports about spikes in the number of critically ill residents in the northern and southwestern parts of Missouri as a result of the COVID-19 Delta variant, this week's public health questions are about COVID-19 variants. Lionel from zip code 63106 asks, "We've heard a lot about virus variants over the past couple of weeks. What are variants?" We know that viruses constantly change and become more diverse. These changes are known as variants of the virus. Multiple variants of the virus that causes COVID-19 have been documented in the United States and globally during the pandemic. There are currently 6 notable COVID-19 variants circulating in the United States: Alpha, Beta, Gamma, Epsilon, B1427 and B1429, and Delta. Scientists are studying these variants to learn how changes to the virus might affect how it spreads, how sick people will get from it, if it can be detected by currently available tests, and how it responds to current medicines, including vaccines. Jess from zip code 63110 asks, "What can I do to protect myself from the variants?" So far, studies suggest that the current authorized vaccines work on the circulating variants. Based upon this data, the City of St. Louis Department of Health recommends getting a COVID-19 vaccine when it is available to you. If you are not vaccinated, the City of St. Louis Department of Health joins the Centers for Disease Control and Prevention in recommending wearing a face covering to help prevent getting and spreading the virus. Wearing a face covering is essential when in public settings and on mass transportation, at events and gatherings, and anywhere when you will be around others who do not live in your household. Also, if you are not yet vaccinated, you should practice staying 6 feet apart from others who do not live with you. And don't forget to wash your hands often with soap and water or use hand sanitizer if soap and water are not available. Preventing the transmission of the virus is the best way to reduce its spread and the potential that other variants will develop. The best tools we currently have to prevent the transmission of the virus are FDA-approved vaccines, face coverings, social distancing, and proper hand hygiene. Please do your part to help prevent the transmission of SARS CoV-2, the virus that causes COVID-19. Portia from zip code 63112 asks, "How common is this Delta variant that we are hearing so much about?" The COVID-19 Delta variant is believed to be the most transmissible variant yet, spreading more easily than both the original COVID-19 virus and other variants of concern in the United States. According to the latest estimates by the Centers for Disease Control and Prevention, Missouri has the highest rate in the country of cases of the highly contagious COVID-19 Delta variant. In addition, the Missouri Department of Health and Senior Services has reported that the Delta variant has been detected in all the sewage treatment sampling surveys in the St. Louis region. We know it is in our environment, so we must do all we can to protect ourselves and our community. According to the most recent data, almost 185,000 residents in the city of St. Louis are unvaccinated and are at risk of developing severe complications if exposed and infected with SARS CoV-2. Youth under the age of 12 are not eligible to receive a COVID-19 vaccine, so we need teenagers and adults to do all they can to protect this vulnerable group. Neil from zip code 63115 asks, "Are the symptoms for the Delta variant the same as they are for other SARS CoV-2 variants?" Clinical information relating to the symptoms caused by the Delta variant is currently limited. According to the Missouri Department of Health and Senior Services, patient data from the United Kingdom, where the Delta variant now accounts for 91% of the COVID-19 cases, disease caused by the variant may not present in typical fashion with cough and fever. An ongoing UK-based study shows that top symptoms of Delta variant infection are headache, followed by runny nose and sore throat, while fever and cough were less common. Loss of smell was not in the top 10 symptoms. Most cases were in young people who had not yet been vaccinated, and the variant appeared to be far more transmissible with every person infecting several others. Thank you for tuning in this week. I look forward to joining you next week for more critical public health information. Let me hear from you, St. Louis. Please send your questions to health@stlewis-mo.gov. Questions will be answered in the order they are received. If I run out of time on air, your question will be answered by return email. Be well.